Welcome to Brain Wellness, the podcast. I'm your host, Mandi NP. Each episode will bring you a new topic or interview related to brain health and wellness as part of my mission to help you on the path to a healthier, happier brain. So, let's get started. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. Today, I have another of the concussion letters of the alphabet, so ABCs of concussion. We are moving on to letter D. So if you've been following along on this series, you know that every time I come on with another letter of this, I have another handful of topics that may be seen or related to something with concussion. So people that have concussion and TBI may experience these things. Not everybody has the same symptoms with TBI, so not everyone will experience all of the things that I talk about with TBI in these ABCs of concussion episodes. However, there are a lot of similarities across the board. So when you talk to somebody who has a TBI, there's likely something that is similar between all of the TBIs that you see. That said, as we talked about last week on the episode, once you've seen one concussion, you've seen one concussion, because not everyone is exactly the same. It's not all textbook. Not everybody will have every symptom, but a lot of the symptoms that we talk about will be experienced at some point or another by most individuals with a TBI. And then some of the other things that we talk about are not symptoms, but they're problems or other things that come up because of TBI or are related to TBI. So again, as with every episode that I've done with these topics, if you have symptoms that you don't know what they might be related to, kind of look back and see when those symptoms started versus when you may have had an injury that could have given you a concussion. Is that something that could have led to a concussion for you, or are you the person experiencing the concussion and you have these symptoms or these troubles as an after effect? So the first topic for today is diagnosis of a concussion, and the diagnostic tests used to get that diagnosis. So first off, I just want to say that getting a diagnosis of concussion can be really tricky. So it's a clinical diagnosis for the most part. You need to see a clinician really to truly get diagnosed with it. However, I do talk to a lot of people that say, oh yeah, I'm pretty sure I've had a couple concussions here and there, blah, 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 but I never got seen for it. Well, that actually throws off the rates of concussion. When you look up, like, what is the rate of concussion? How many people have them? How frequent do they happen? Those rates are really far off because a lot of people don't get seen. A lot of people don't get a formal diagnosis. So getting that diagnosis can be tricky. And even if you thought you have a concussion, you go in and you didn't have the traditional symptoms, your provider still might not say that you had a concussion. Still, there's a lot of people out there just say, well, I got my bell rung, or yeah, maybe I saw stars, but they don't really think of it much more than that. And even as providers, if you don't have the typical symptoms, a lot of providers will miss that diagnosis because you don't have the classic symptoms. And again, as we've talked about in previous episodes, a lot of people think that you have to lose consciousness. I really kind of took that off last episode when we talked about the consciousness issue in coma, and only 10% of patients actually lose consciousness. So most people with a concussion or TBI don't actually lose that consciousness. So we can't be using that as a threshold for whether or not somebody had a concussion. There are not a lot of diagnostic tests that can confirm one way or another, which is why I said it's mostly a clinical diagnosis. You go in, you see your provider, they do a physical exam, and that physical exam will help to identify your history, will help to identify, but that diagnosis itself can be very subjective depending on which symptoms you present with, how, quote, severe those symptoms seem, and then the knowledge level of the provider that's doing the assessment. If it's somebody who's not seen a lot of concussions, or they're not aware of the wide variety of symptoms that can present as a concussion, you still might not get a good diagnosis with that. Some of the diagnostic testing that we have and that you will see. So when somebody goes in with an acute injury, they recently got injured, they were in a sporting event, they were in a car accident, they had a fall. One of the first things we do is always a head CT, not because we expect that head CT to be abnormal, but we actually expect it to be normal. What we're doing in that setting is ruling out major issue. We're ruling out the fact that the person might have had a bleed in their brain. So we could do that head CT because that CT will show us right off the bat if there's blood happening right now on the brain. So we talked about that in letter B with the brain bleed. That was one of those big topics that we covered in that letter B episode. We're on to D now, but that head CT just rules out that bleed. It does not rule out a concussion. So just because you had a negative CT does not mean you did not have a concussion or a TBI. Just means there wasn't a major bleed that we could see on that CT. MRI, similar thing. So when you come to your provider, if it's been more than a few days since you've had your injury, most often you're going to get an MRI done. Or if you have symptoms still, you're going to get an MRI done because that CT is only helpful in that acute phase, that hyperacute phase. That MRI is going to be more helpful later on down the road to see, looking for the same thing, if there has been a bleed on the brain. MRI is more specific to it and more sensitive, so you can catch smaller bleeds on an MRI than you couldn't see necessarily on a CT, and especially in the back part of the brain where there's a lot of bone obstructing the view. MRI is much better for that because it takes out that bone view. We're not obstructed by the bone anymore, and we can see bleeds a little bit better if they do exist. But then again, it's really not going to say that if you have a negative MRI, that does not mean you didn't have a concussion. It does not mean that you didn't have a TBI. It just means you did not have a bleed with your concussion or TBI. There is a specific type of MRI that might be a little bit more helpful. It's called a functional MRI. Sometimes you'll see it abbreviated F, the little F MRI. That can be done to highlight different changes in the brain. It highlights areas of function that are not functioning as they are supposed to. So it gives different colored schemes. And that functional MRI can highlight areas that are not functioning appropriately due to concussion. That said, it's still considered largely a research tool, so it is not generally covered by insurance. It's not widespread use. A lot of people don't have access to it. Your provider is not likely to order it for you because it's not going to get covered by insurance, and it's a very expensive test. And it requires a specialized practitioner to interpret it. So not just any radiologist can look at that MRI and interpret, not any neurologist can look at it, interpret it, because it's such a new test. Not everybody has had access to it. So it takes a specialized person for that. Neuropsychological testing, another diagnostic test that we use, can identify cognitive changes due to the concussion. But again, this one, not so much that it isn't covered, because it is covered by insurance and it is a pretty typical traditional test that we use. However, it can take months to get in. The wait list is 2 to 3 months, if not longer, to get in with a neuropsychologist to get this testing done. And it's a lot of work. It's a 4-hour test. I've had this done twice in my 1.5 years plus here recovery. It's a lot of work. It's a really strenuous day. It takes a lot out of the person that has the injury because there's a lot of cognitive effort needed to do this test. So my test, for example, even when I did my first test several months, like say, I think it was about 6 months after my accident, it had me in the low normal ranges for several parts of the exam. So I say this to say that higher functioning individuals may not appear as impaired because, again, mine was in the low normal, though my neuropsychologist said that given my intelligence and my level of education and experience, she would have expected much higher from me had I not been impaired. So she still documented as impaired, even though it was low normal for several areas. This is when it really highlights that it would have been great to have a baseline test so that I knew what I was functioning at prior to my injury. I know physically that I was functioning at a much higher level than I do now, but it didn't show on my testing. So it's a little bit more subjective in that sense because when you're higher functioning, these kinds of tests don't typically show impairment quite as much as it would in people who aren't necessarily as higher functioning. And higher functioning, I mean like cognitive higher function. I don't mean like what you do on a daily basis. There are people that are very functional, very successful, very good at what they do, but their brain just doesn't work at that same level. So I don't mean to put anybody down with that. So I hope you don't take that the wrong way, but it's just looking at how our brains function and where we fall in those testing ranges. There are computer-based exams that can look at your concussion level and your symptoms and how involved your symptoms are. There are things like impact testing that's done through the Concussion Heads Up program. So impact testing is done for a lot of athletes now in different sports facilities. It is used by lots of high schools, colleges, universities, and even military and professional teams use these as well. The impact testing measures things like memory, attention span, visual and verbal problem solving, and then they actually get a baseline test with that. So that is one that the athletes have to get a baseline test so that they have that knowledge of where the person is prior to an injury. So that when they do sustain an injury, they complete the test again, and that tells them whether or not they're able to return to their activity yet, because it looks at their level of symptoms, the level of severity. Are they able to return to that sport yet or not? It is not a diagnostic test used by itself, but it is used in conjunction with other evaluations. So they would still need to be seen by a provider and evaluated, but this particular test will just tell them if they're ready to return to their activities. There are other tests like automated eye tracking tests for acute injuries. There's something called an eye box by Oculogica. This test was actually developed by a neurosurgeon who works here in Minnesota. So this test is based on your cranial nerve function, so the cranial nerve control of eye movements. So when the cranial nerves are impacted by a concussion, the eye box actually gives a score that measures the absence or presence of the concussion. So this can be seen again in an acute setting. So if somebody has that injury, they go in, this can help to diagnose that injury early on. Dr. Samadani presented this on a TED Med Talk. So if you like do a Google search, you want to look it up more on your own, type in iBox, IEYE box, BOX, by the company Oculogicas who supported it. There's a video link to her TED Med Talk right on there, how she talks about how this testing can be useful. And it's a really cool test to do this. I did this once several months after my injury, I think probably like 8 or 9 months. So I was no longer in the acute phase. And at that particular point, it didn't identify concussion, but I'd already been through a lot of treatment and therapy at that point. So my vision was already improving, and I no longer had the severe difficulties with my vision tracking that I did right off the bat. So it would have been really interesting to see this right off the bat, so I could have seen what my response was right away and gotten that score. This test, unfortunately, is still considered investigational. So even though it was on a TED Med Talk like over a decade ago, she's done a lot of it and a lot of research on this. She's been researching it really since 2012, but it's still not widely covered by insurance. Some insurers will cover it on a case-by-case basis, so that might be covered there. The nice thing about this one is that when doing a quick online search to find the pricing on this one, it typically costs individuals around $50 to $60. So it's not an expensive test. So even though it is not covered by insurance, it's not going to make a huge impact on your bank account like some of the other tests would, such as the functional MRI. That would be thousands probably. There is another up and coming test for blood testing. The Abbott Industries has developed a blood test that has been approved for use with adults with suspected concussion. It measures two biomarkers, the ubiquitin C-terminal hydrolase L1, abbreviated UCHL1, and the glial fibrillary acidic protein, abbreviated GFAP. So those two biomarkers are measured in this little iStat test. It was developed in collaboration with the Department of Defense. So at some point, I'm hoping that we will see this one covered and more of it more used, more widely available. But it literally just started popping up on LinkedIn in the last several months. So it's just new out there. It is an iStat finger prick test. So for those of you that work in the emergency room and you're kind of used to those iStat tests, this is just another one of those iStat finger prick tests. The results are available in approximately 15 minutes. However, it is tested on plasma, so it does need to go to the lab at this point. Whole blood testing is being developed to reduce the need to send that blood to the lab so that it can actually be done at the bedside as an iStat test with that result within 15 minutes. A negative test result on this particular test rules out the need for a head CT because it basically says that you haven't had a bleed on your brain. But a positive test can complement the CT in evaluation of a concussion. So again, not a test by itself to diagnose, but even in a negative head CT, it can still tell you that those biomarkers are there and somebody probably had a concussion. So that can help to steer that diagnostic testing and treatment plan in the direction for the concussion. Again, unfortunately, this test is still considered investigational, so it is not generally covered by insurance, not available in all areas, though it is FDA cleared. I have seen that there are places in the United States, mostly down in Florida, that have started to use this test, so it is starting to get out there. I could not, however, find any cost information online. Abbott is not releasing the pricing schedule, so I don't know what it looks like for people who don't have insurance to get that test done yet at this point. But some up and coming tests. So that kind of wraps up just a quick conversation of how do you get that diagnosis, what kind of diagnostic testing there is, really the fact that current practice, we don't have a lot of tests to rule in or rule out that diagnosis. It's really a clinical diagnosis. So again, very subjective on that. So again, starting to look at some of those symptoms. The first symptom starting with D is dizziness. This is similar to that balance discussion that we had in the B letter topics. However, someone can feel off balance and not truly be feeling dizzy. They just feel like their balance is off. So the balance conversation was a little bit different than the dizziness conversation here. When we're doing examinations on patients and we ask them about feeling dizzy, we always have to ask somebody to describe what that dizzy feeling is. Do you feel like the room is spinning, or do you feel like you're off balance? And if the room is spinning, are you spinning in one direction or the other? Is the room spinning one way in the room and you're spinning the other way? Like, what's going on with all of that? So that we can truly identify what is your definition of dizzy, because everybody's definition of dizzy is a little bit different, as I found in my years of practice as well. Dizziness in this sense can be caused from several things. It can be a disruption of the vestibular system in the inner ear. It can be a disruption of the neural pathways that process that vestibular information, or it can be sensory conflicts, such as with vision troubles, inner ear issues, bodily injury due to the accident that caused the concussion itself. Those sensory conflicts, because of those particular injuries, can cause that dizziness to occur. Other things that can play a role in whether or not someone feels dizzy or how dizzy they feel include things like hydration, whether or not they have headaches, because headaches can increase those feelings of dizziness. Neck injuries, there's a huge connection between neck injuries and dizziness. That's been diagnosed or researched in the literature for decades about how neck injuries can lead to dizziness and falls, especially in older patients. Medication side effects can cause dizziness a lot. Sudden blood pressure changes, such as with autonomic nervous system dysfunction, we talked about that back in letter A. Those things can all cause or increase those symptoms of dizziness. Autonomic dysfunction can also cause dizziness with position changes, not just sudden pressure changes with the blood pressure, but that position change in particular. Visual difficulties can add to the feeling of dizziness. So if your depth perception is off, if your field of vision, your actual visual fields are disrupted, that can cause problems with dizziness also. What do you do for dizziness? We do a lot of therapy. So physical therapy works specifically on vestibular system. They do a lot of vestibular related exercises. Your proprioception can be off, meaning your sense of where you are in space can be off. That can affect your dizziness. So there are specific workouts and exercises that your physical therapist will have you do that work on that vestibular system to try to correct those things. I recently learned about a group of providers called neurological chiropractors. Some of them call themselves neurologists, some of them call themselves neurological chiropractors, chiropractic neurologists, neuro-focused chiropractors, all these different terms that can be used. But the people that work specifically in this, they do more of a functional medicine practice. And they do more specific testing, again, on specific types of autoimmune dysfunction and disruption. Disruption of the optic kinetics within your eyes, so your ability to sense the things around you in your visual fields. And then they have subsequent exercises to work on these issues. I'm still learning more about that, but I'm excited to get more knowledge and more education on that topic as well. If vision is a problem leading into some of these dizziness issues, vision therapy will work on the vision portion of that as well. Other things, if you are not drinking enough water, dehydration can definitely make dizziness feel worse. So staying on top of hydration, making sure that you eat a good balanced diet, getting plenty of protein in, because lack of proteins can also make you off balance, making sure that you rest, let yourself heal, and then reduce stress as much as possible. And I say that tongue in cheek a little bit because stress is always going to be there in the recovery process from TBI, but trying to reduce that as much as possible. When you're stressed, your symptoms are going to be worse. So enough said on that one. Depression. We have kind of talked about mental health issues the whole way through the alphabet here so far. And depression has several factors that go into it as well. Having depression prior to a concussion will increase your risk of having depression after the concussion. Depression itself after the concussion can be caused by changes in your quality of life because maybe you can't get back to work. Maybe you have physical symptoms still that are limiting your abilities to do your normal things that you do. Or maybe you have functional changes just from the injury itself. Injury to the brain can actually cause changes in the chemicals, those neurotransmitters that can lead to depression as well. So there are chemical causes of depression after a concussion, not just the fact that you might be perfectly fine physically, but the chemical changes can cause that depression itself. People with persistent post-concussive symptoms. We talked about that last week with my guest. People with PPCS are at higher risk for depression. And approximately half of those people that do report concussions now, so again, our numbers are quite off, but half of the people that experience concussion that we have on the charts will experience depression at some point, most of those within that first year. More than half of those people also have anxiety that we talked about back in the letter A category. Treatment for depression post-concussion is very, very much the same as depression at any time, regardless of whether or not somebody had a concussion. So the medications and or counseling options are definitely helpful for people. Other treatments that can work for the depression can be exercise. We talk about that all the time. It is the most underutilized antidepressant out there, but it can be difficult for that person recovering from a concussion. Acupuncture can be helpful, biofeedback, red light therapy, all of these things can be helpful to treat depression. And depression should not be ignored. So that's something that really needs to be monitored. It happens very commonly, and that can make symptoms worse as well. If somebody's having depression, that can actually slow down their recovery. So it is important to get that treated. Yeah, I think that's enough said on that one because we talk about mental health all the time with this one. The next symptom then is double vision. And again, I talked about this last week a little bit with that conversion insufficiency. So the double vision, just as we described with that conversion insufficiency, or it can be double vision related to cranial nerve injury, leading to weakness of the muscle movements or incoordination of the muscle movements in the eyes, so that those eyes are not tracking together, so that we have that double vision. Double vision can lead to balance problems. It can lead to dizziness, as we already talked about. And it might not be so much that you distinctly see two objects. That was my problem when I first did. It wasn't that I could say that I'm seeing double. It just wasn't clearly one object. My eyes were not converging to create that one single object. So it might just be that people see blurry. They're seeing these blurry objects and they can't really decipher that it's double vision, but it just is not clear. Double vision can lead to a lot of eye strain and headaches. It can lead to sensitivity to light, difficulty focusing on objects. It can affect your depth perception. So you can have a problem parking a car, moving things, setting things down on a table without dropping them. It can lead to fatigue or headaches while driving or while working on a computer or reading. And people don't really catch that all the time. They just see, well, I get tired when I'm driving or I get tired when I'm reading, but they don't know the cause of it. And it can be from that focus. Their brain is trying to focus to create that image really clearly so that they can see while they're driving, so that they can see while they're reading. And that can lead to those headaches and that fatigue. So it's not just the headaches and the fatigue. There's something probably underlying that's causing it. The double vision that can be seen after a concussion can also be worsened if somebody has a pre-existing eye condition prior to the concussion, as was my case also. I had a lot of visual difficulties prior to my concussion that complicated my convergence insufficiency and my vision difficulties even more. So yay, fun for me. The double vision seen after a concussion can go away on its own as the swelling and inflammation on the brain improves. But if it doesn't go away, you might need to get more evaluation. So if you haven't been seen by a neurooptometrist yet, now's the time to do so. There aren't a lot of them out there. There are only a couple in the Twin Cities that I can think of. If you're in this area and you need a recommendation, please let me know. I had one on my show about a year ago. My neuro-optometrist, he did a great job, and I'm so grateful that he came on the show to share more information on the visual needs as well. So you can kind of go back and look at that eye doctor. He's here in the Twin Cities, but again, if you need to find one close to you, make sure that you get a referral to a neuro-optometrist or a behavioral optometrist. That's going to be the person that's going to catch those really intricate problems that you have with your vision related to the concussion. Treatment then would be OT for vision therapy and their exercises that they give you, which will be a whole host of different exercises depending on the problem that you have with your eyes and how well it's responding to those therapies. Prism glasses may be needed for a short period or longer. Syntonics is a specific type of therapy that uses different lights. So I actually had different colored glasses that I had to put on and look at a light to get my eyes to focus on that light differently. It treats the autonomic nervous system involvement that causes problems with your vision. So a whole nother type of therapy there. And then again, that neurological chiropractor that I learned about recently for more specialized treatment, because there were several different eye tests that he described to me that I have not done that I recall with my neuro-optometrist or with my OT vision therapist. The next topic is an interesting one. It's distraction. So we talked about this a little bit with concentration in the A episode. We talked about it a little bit with ADHD in the A episode. So you can think of this as the opposite of concentration, being distracted. When you can't focus on things, you can't concentrate on things to keep that train of thought or to keep that thought process going long enough. Through talking with other friends that I have that are also TBI warriors, it is very clear that that distraction is a very common issue after concussion. But when you Google it and you try to look up what to do for it, there's very little information. There's some things about concentration, but there's really nothing to do about what happens when you get distracted. So it's very easy to get distracted in conversations when you're trying to complete really any task, if there are any other conversations or activities going on around you. So if there's multiple things happening, it's really easy to get distracted and kind of lose your train of thought. I used to joke that as I was cleaning my house, even before my accident, I would have what I'd call ADHD cleaning. I would start with one thing and then have to bring something into a different room as I was organizing, and I'd get distracted by something in that room. And I would do all of these different things that I would partially have projects going in my house and I wouldn't get one thing done. That tends to be life in general after a concussion because it's really easy for you to get sidetracked. You forget what you were doing when you go to do one thing and you start doing something else. So it's very, very easy to get distracted and just kind of go from one activity to the next. Prior to the injury, though, I used to say that I could tune things out. So in nursing school, I studied in coffee shops. I had no concerns with that. I was able to focus on my textbook. I could take my notes. I may or may not have music playing in my headphones while I was doing all of that, but I was able to study and I did quite well. I remembered everything that I needed to remember, and I could be in that busy environment and not get distracted and not have any problems. In a busy hospital when I was working, I could see patients over and over, and things were going on all around me, and I had no issues with it. And really, I could do just about anything and not get distracted. And I could remember what I was doing, remember all the different things that I was doing at the same time. After the injury, however, I have difficulty just placing my order in a busy coffee shop sometimes, not even having a concentrate conversation, not trying to read something, trying to focus on something, just placing my order, looking long enough at the board to try to figure out what I want to get. So depending on what my day has looked like, what day of the week it might be. At the end of the week, I have much more difficulty with distraction than I do at the beginning of the week after I've been able to rest over the weekend. And then when I went back last summer to try to shadow at the job where I was when the accident occurred, there was so much going on in the hospital that I couldn't follow conversations very well. And that was one of the main parts of the reason why I was not able to return, and my job was ultimately terminated on that because I could not get back to that same level of function in that environment. And I've talked about multitasking on other episodes, including last week with my guest. We talked about multitasking, and that multitasking, anytime you're multitasking, it requires your ability to focus on multiple activities at once and split that focus so that you can do multiple activities at once and not get distracted or lost or what you're doing. Since the accident, I struggle to focus on just one activity. So multitasking just is not an option. That's distraction is too highly variable there. So what can you do if you're being easily distracted by things? When you look online, there's very little out there. They say to avoid activities that require a lot of concentration for a few days after your accident, and then gradually increase your activities. And to that, I say, well, duh. That is kind of the goal with any of them. You want to let your brain rest for a couple of days, and then you want to gradually increase your activities. However, if you're one of those lucky 30% or so of patients that have persistent symptoms, what do you do after those first few days? What are you supposed to do to this? To that, I say, listen to your body, take breaks when you need them, because if you are trying to push yourself past the point of exhaustion, you're not going to be able to focus. Your distraction level is going to be going up and up and up, and that concentration goes down. Your symptoms get higher. You're not able to keep yourself from being distracted. My therapist, as I was going through PT, OT, speech, all of them gave me different exercises to work on. One of the big exercises was to try to desensitize myself to all of the overstimulation and that inability to get distracted. So when I first had the injury and I would try to go to the grocery store, I would get so easily distracted by everything around me that I couldn't focus on my list. I'd get overwhelmed. My symptoms would get heightened, and I couldn't last very long in the grocery store. But I had to be able to go in that environment, especially if I wanted to try to get back to work, but definitely to try to get all my grocery shopping done, I had to be able to go. So we started trying to do some desensitization. I would go into the store for brief periods of time. Ideally, I only had like a couple things on my list, and it was like 10, 15 minutes at a time. I would go in, and most of the time when I go to the store, I would go specifically to that aisle that I needed. I would go get my item. I wouldn't look around. But for the purposes of trying to desensitize, I purposely was not allowed to just go do the two things that I was going in the store for. I had to walk up and down the aisles, look around, keep my head up, not look down, and really take in all of the sounds, brief periods at a time. She wanted me to go to the point where I could do 10 minutes without symptoms coming on. So slowly working my way up to that so that I didn't get so distracted and so overwhelmed by everything that was going on around me. And if you have to do something that requires your attention because of that inability to prevent distractions, you need to stop doing other things. You cannot try to multitask at that time. You need to focus on something that you need to really remember it. I always say now that when I'd be working on things at home on my computer, my kids would come up and try to talk to me. I could still type and have a conversation with them, not a problem. But now if I want to remember anything that my kids are saying and I want to correctly do what I'm doing on the computer, I literally will hold up a finger and have them kind of halt and wait until I get to a good stopping point in what I'm doing. And then I will look up and my kids then have my undivided attention because I want to hear them. I want to remember what they're telling me. So I need to finish the thing that I'm working on, look up, give my kids that undivided attention so that I don't get distracted during my conversation with them and so that they're not a distraction for me on what I'm trying to work on my computer. So get to that good stopping point, stop them. And they've learned now that when I put my hand up, I need that 1 second, 1 minute so that I can get to a good stopping point so that I can give them my undivided attention because I want to remember what they're telling me. I don't want to later on wonder what they were talking about because too often my kids would tell me a story or tell me something about school and I would forget that they told me about that thing. And I could still forget even if I was trying to give them my undivided attention, but I definitely would forget if I didn't stop and pay attention to what they were saying to me. Recovery from a concussion requires purposeful activities. Recovery from that distractibility requires purposeful activity so that you can increase your ability to focus. Your brain is not going to heal all the time by itself. You have to help it along. The next topic is disability. This one is another one that I struggle with a lot because there's just so many meanings to it. So when we think about disability, post-concussion syndrome itself can be considered a disability depending on the length and the severity of your symptoms. Most people have no issue getting their short-term disability. So if they miss work for a period of time, they need to be out. Most people have no issues getting to that point where they can use their short-term disability from work. But unfortunately, all too often, that long-term disability claim gets denied, and people have to um, either get a disability lawyer or refile on their own. I had to refile multiple times before mine got approved, and it shouldn't be that hard to get the help that people need when they need it. Social Security disability, also very difficult to get. Most people get denied the first time and again the second time. And most people need to get a lawyer in order to get that application through and actually have it approved. I just received word that mine got denied, and I need to figure out my next steps for that as well. So there's a lot of documentation involved in filing for disability. There's a lot of medical documentation for one. So you need notes from your medical providers and therapists, ideally, to describe what your current symptoms are, whether you're still attending therapy regularly, proof of any medications, and then proof that those prescriptions are being filled by the pharmacy. They will go back and get that proof from your pharmacy as well. And then you need documentation to prove that this is not a pre-existing condition. I have a history of migraines prior to my accident. So the first time my long-term disability, or no, second time my long-term disability was denied. It was because they were trying to say that because of my underlying history of migraines, that contributed to my current symptoms. And I said, wait a minute. Yes, I had migraines, but I never missed work because of it. So while my history of migraines is a risk factor for people having prolonged recovery, that should not prevent me from getting disability for this. So I actually, prior to my accident, I was working multiple jobs. I had a full-time job, I had a part-time job, I had the podcast, I had my kids, I had all of the things going, and I had excellent attendance records at work. So I was able to get my multiple employers to write letters for me that describe that I did not miss work because of my previous diagnosis. And in fact, I worked above my scheduled appointment at both positions because I was I was on top of my schedule. I did not miss work because of this. So those letters helped me to get approved my final time reapplying for the long-term disability. There is a huge amount of paperwork in general that is required for these applications and reapplications. So in addition to getting all of my work notes, my medical notes, I had 10 multiple times that I had to fill out like 10 plus page documents that I had to complete to talk about my symptoms, who I was getting treated by, where I was going, what was happening, blah, blah, blah. It's difficult to do all of that when you have a brain injury. So all the documentation required, and you're the one with the injury that's trying to get covered under disability because you can't go to work. Being disabled from work is mentally exhausting in itself, even outside of filling out all of the documentation, getting all that paperwork done, applying, reapplying, blah, blah, blah. Especially when you worked so hard to get into the career that you have. Being disabled can lead to depression and anxiety over financial issues because of not being able to get back to work, physical changes because you can't do the things you used to be able to do, and then those mental changes, just the cognitive issues, the memory, and then the depression, the anxiety that comes with it. You can't medicate away the grief over being disabled from the career that you love. Uh, Now I am, again, 20, by the time this show comes out, 21 months into recovery and not being back to work as a nurse practitioner for 21 months when I worked for 10 years of college, plus all my post-secondary education classes I took in high school to get the degree that helped me provide for my family. You cannot medicate away the grief of not being able to do that kind of thing that you work so hard for. And unfortunately, post-concussive disability is still very much an invisible disability. So many people just don't understand it. You look perfectly fine, so how in the world can you be disabled? But I will tell you from my own experience, it is hard to be a provider and treat someone when you can't remember their history and exam once you step out of the room. So even though I look perfectly normal, that's what has kept me from getting back to being a provider again. It's getting better. My memory is getting better. We're getting there. and I'm hoping that it's on the horizon sooner than later, but that's what's kept me out of being a nurse practitioner again. I will leave it at that for right now. The next topic, delayed symptoms. We talked about this a little bit previously, and I talked about it kind of up in the diagnosis section as well. So most people think concussion symptoms appear immediately after an accident, but it can take days or weeks for the symptoms to appear. It might also be months or years before people really acknowledge those symptoms. So I won't say it's necessarily months or years for the symptoms to appear, but it can be that long for people to acknowledge that symptoms are present and then seek assistance to figure out why they're having those symptoms. Some of those symptoms might not be appreciated right away, like with mine. I had incredible headaches for months after my accident, and it wasn't until those headaches started to finally taper off that we realized that I really had such significant cognitive issues. My provider and I and everybody around me thought that I was just having memory troubles because of my headaches. Lo and behold, it was not just the memory problem or the headaches that was causing my memory issues, but we didn't realize it right away. We couldn't appreciate that first off because there were other things kind of masking those symptoms. Some of it's like peeling back the layers of an onion. Once you treat some things, you realize that there are other things that you need to treat, and then you shift and you treat those newly uncovered symptoms. So it's not so much that they weren't there, but you couldn't focus on them because other things took priority. Sometimes long periods of time can go by without identifying the cause of symptoms because some of those concussion symptoms can be pretty vague. And if the person didn't lose consciousness at the time of injury, we've talked about this again lots of times, they don't put two and two together and realize that it might have been the injury that caused it. Therefore, they don't realize it could be concussion related. So I talked about that earlier. And the trouble with those delayed symptoms is that they often don't get attributed to that injury. They get misdiagnosed as other things. So then they're going down this rabbit hole that shouldn't have been there to begin with. So again, if you're listening and you find that you're experiencing any of the things that we have discussed and you don't have an explanation for them, think long and hard about when those symptoms started, how long have you had them? And if it hasn't been all your life, but if it's been something that started at a certain point in time, what happened prior to that? Did you get in an accident? Did you have some sort of injury that may have led to a concussion? If that is a yes, I do encourage you to seek help because it really is never too late to get treatment for some of these things. Next topic is driving, and driving can be affected by mental or physical concerns after a concussion. Some of those physical concerns, for example, vision troubles, headache, balance, fatigue, all of those can lead to difficulty driving. We've talked about many of those already. Usually it's limited to a time frame. So if you drive for a certain number of time or certain length of time, that will bring on those symptoms that will make it difficult for you to drive past that. That can improve over your recovery period. When I first had my accident, I couldn't go for more than half an hour before my symptoms got really bad. Now I have been able to go to an hour and a half. So hour and a half, I can drive. I haven't tried anything beyond that for a long period of time because I still do get fatigued and I hit my wall. And if I'm driving anywhere, that means I have to do something once I get there. So I do have to conserve some of that energy. But I used to be able to drive pretty much unlimited time frames. Not anymore. Mental issues that can lead to difficulty driving. The biggest one is PTSD. We will talk about that more in the P letter way down the road. But especially if your injury came from a motor vehicle accident, PTSD can limit your ability to drive on your own or for long distances, depending on what the symptoms might come up as there. But your treatment for any of these issues is going to be treating the underlying cause. So if it's a physical symptom causing the difficulties, you're going to follow those therapy plans to work on improving those symptoms so that you can improve that way. If it is PTSD, you need treatment specifically for that, such as EMDR, which I'll talk about in the next letter E episode. We'll go into more detail. We have kind of hinted to it several times here on the show, but I'll talk about it much more in the letter E category. And then the last topic I wanted to talk about today is probably one of the more severe cases with it, diffuse axonal injury, DAI. It is a specific type of TBI that comes from a blunt force injury to the brain. Most often, this is from things like domestic abuse. In babies, we see it with shaken baby. Motor vehicle accidents, rapid falls, direct hits to the head in sports can also cause it as well. But any of these, you would have to have an injury to the brain. It has to be a sudden type of injury where we can see these just kind of multiple essentially multiple little bleeds or multiple little affections in the brain. It is the leading cause of death and disability in children and young adults, and does fall into the category of severe TBI, as I mentioned. Often has a GCS, a Glasgow Coma Scale of 8 or less for over 6 hours. Normal GCS, for those of you that aren't aware, is 15. So this would be a very low Glasgow Coma Scale. I remember when I learned about this GCS of 8, you typically need to intubate somebody because they cannot control their respirations on their own. So think of it that way. It's a very severe traumatic brain injury that often requires intubation, and the patient has had a very severe injury. It is largely a clinical diagnosis. The definitive diagnosis cannot be made until autopsy, unfortunately, when we can really see the damage to that the particular areas of the brain where we can get that definitive diagnosis. Head imaging might identify multiple punctate hemorrhages, punctate being tiny, so multiple tiny little hemorrhages scattered throughout the brain. MRI would be preferred over CT to see this. It is suspected that diffuse axonal injury accounts for about 10% of all severe TBIs. There is a very high mortality rate, and many others that do not have high mortality related to it end up in a persistent vegetative state, and complete recovery is usually not possible with this. I share this last bit of information not to be a Debbie Downer, but to say that there are definitely different levels of injury with TBI. This is, again, why not every TBI is the same. They are not all created equal, which is probably a good thing on many terms, but that diffuse axonal injury would be probably one of the most severe forms of TBI. Not seen very commonly, thank goodness. Only 10% of the severe TBIs, and even that is pretty small. Most TBIs fall into the mild TBI category. And I know we've talked about mild TBI here before. The term mild is definitely a misnomer, because any of these symptoms that we talk about can affect people to a significant degree. So mild does not equal mild. It's not minimal. My mildish TBI has kept me out of work for 21 months. So it can still be very devastating, even if it's not a life-threatening injury. That said, again, if you think you have had a concussion, please get evaluated. And if you're not getting the answers that you want, look for another answer. Look for another provider. See if you can keep looking around and find the answers that you need, because you need good treatment so that you can get back to better functioning. Again, if you have other topic ideas that you would like me to cover in an upcoming episode, I am working on E through Z, the rest of the alphabet. So if you have any other topics that you think I should cover, please enter them in the comments. You can send me a message directly on any of the social medias that I have posted in the show notes as well. I am always open to ideas. If you have other interviewees that you think I should reach out to, please do so, because I'm always looking for more people to be on the show and share their insights, TBI related or not. If it's neurological, if it affects the brain, it can be appropriate for this show. So again, thank you guys for listening. Let me know if you have any thoughts, questions, comments, concerns moving forward. Otherwise, I will see you next week. Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, like, and share this with others to help me continue on with my mission to help people live healthier, happier lives. Go to www.brainwellnesssolutions.com to see what I'm up to and get links to all the social medias there. See you next time.